makatao pa.
Together we are being called to make a future world. The test we face is for us to prove that we can heal as one. We heal as one with kindness. We heal as one. We serve, we share, we show compassion. We heal as one.
Sa pari mo'y nag-iisa.
But when we heal, we heal.
We heal as one.
The country are occupied at more than half the capacity for COVID-19 patients. Metro Manila is reaching the danger level for full occupancy, and 7 other regions are almost at warning zone levels. As COVID-19 chief implement says that prior to the pandemic, Vice President Denny Robredo has a different message. Filipinos can face and survive this challenge. But will government improve its response to the health crisis? We discuss in this episode of the Chiefs. Welcome to this special edition of the Chiefs. With me right now are Ami Pamintuan of the Philippine Star and Luke Speaker of News of Chiefs. Welcome.
Good evening.
Ami, ano bang balita?
Puro nakakatakot.
Yung record highs, record high na, di ba, single day in
Yes.
almost 4,000
Yeah,
and record high recoveries
recoveries.
na data reconciliation based.
That's what DOH is now very quick to emphasize, and let's try to emphasize that. Sabi naman natin, gusto nyong damihan yung testing, and not only that, you say you want to improve the data collection and tracking. So now DOH is saying tumaas ang numbers, not only because tumaas ang testing, but because they're doing a better job possibly of reconciling the numbers between the health centers and LGUs, which is very crucial.
Right, yeah. So yun ang ating tanongin, no? Kasi we really want to understand the science behind the numbers, no? Imagine from something like 30,000, no? It's now 65,000 on a single day. And this just based on data reconciliation. So, you know,
At saka yung daily recoveries, di ba? Parang,
yes,
you know,
yung recoveries, yeah. So, on the one hand, of course, you're happy about that. On the other hand, you're worried if, you know, that's really the right way to record it, di ba?
Saka nakakatakot sa mga ginagamit ng mga words ngayon. Merong danger zone, may warning zone. Sabi ng yung pandemic plan down natin is crisis phase. Yung pandemic planning lang naman. Siguro linawin natin dun sa guest natin kung ano talagang sitwasyon. Kasi
diretso na tayo. Yeah. Diretso na tayo. Joining us is Health Secretary Maria Rosario Vergere. Yusek Vergere, welcome po to the Chiefs.
Good evening po.
Good evening po. Yes, good evening.
We'll let you qualify everything we've been saying para umpisahan ka agad natin. When you say we're now reconciling the data and this is leading to the higher numbers we're seeing now, what does this all mean?
Well, as we have always mentioned, we started reconciling data so that we can have improved numbers. Our main objective is for us to have accurate, timely, and complete data. So we started coordinating well with the local government units, strengthening our regional offices as well. So this line list that we get and the imputations that we have done we were able to get all of these recoveries in a matter of this week. We have worked on it. So if you remember last May 15, I think that was we started imputing these recoveries, and we were able to add an additional 4,000 recoveries last June 15. And this was also the process that we have undertaken right now. So pag tinignan ho natin yung mga kaso natin sa ngayon, pag tinignan ho natin yung classifications nila, we only have around less than 2% of these severe and critical cases. And then the rest would be mild and asymptomatic cases. And mild and asymptomatic cases are supposed to recover after 2 weeks of being isolated or being managed. So we started, the main gap there would be that LGUs and the reporting units are not reporting the outcomes of patients. So naipon po ng naipon through the months, and when we are starting to clean our database, so we started identifying these individuals without outcomes, and we removed all deaths and the severe and the critical, and we were left with this number which have already passed that 14 days of isolation kung titignan po natin, and we imputed it statistically and we got these numbers.
Okay, now ma'am, just to manage expectations, kasi yung mga tao, lalo na tomorrow, magugulat na, 4,000 yung nadagdag. And we're gonna help to explain na hindi kasi nag ng numbers. Pero ito pong reconciliation ng numbers, one time, big time ba po to? Or do we expect these numbers, these levels of cases to be at this level moving forward?
Oh, well, if you try to look at our numbers, if we talk about recoveries, we only have now 22,327 active cases, meaning these people, most of them would also still be mild and asymptomatic. So this process will be undertaken every 15 days so that we won't miss out on these individuals that are supposed to be tagged as recovered already but are missed out by the reporting units.
Okay, so meron din po kayo nung under the new IATF guidelines, DOH's recommendation is for time-based reckoning. Pakipaliwanag nga po yun, ano pong nagbago dun sa reckoning ninyo ng mga kaso under the time-based?
Yes, actually, Lucy, when we started analyzing our data and looking at the different implementation of our reporting units, we have noted that there are a lot of misinterpretation of our policies and the protocols that we have. Some of our reporting units would be tagging people or individuals who are positive after 21 days, after 28 days. Some people would only tag them after they have undertaken or undergone additional 14 days from the 14 days that they have been isolated from the hospital maybe or at home. So it takes 28 days before they can tag it as recovered. And this is not in line with the protocol that we have with the guidelines. So that's one challenge. Yes, another challenge would be that, as I've said a while ago, reporting units are not reporting the outcomes of these individuals. That's why nag-backlog po tayo at hindi po nalalagyan. So we had a lot of numbers without outcomes. So we had to do statistical imputation so that we will be able to complete this data. So kung makikita po natin ngayon, yung 22,000 na natitira, makikita ho natin almost siguro po mga 90+% of those would be mild and asymptomatic, and we will be continuing with this process every 15 days.
Yes, but what's so when we reckon a person infected to be recovered on the 14th day?
Yes. Specifically in our department memorandum that we have issued, it states there that if you are an asymptomatic, confirmed positive individual, after 14 days of being isolated, if you did not have or did not develop any symptoms at all for those for that period of time, you will be tagged as recovered after the 14th day. If you are symptomatic and you are classified as mild, from the onset of illness, if you are already asymptomatic without symptoms already, and the doctors would give you that clearance, you just need to finish the 14 days from the onset of illness. So 14 days din po ang bibilangin at
Nawala.
Yeah.
Hmm.
Okay.
Okay.
Pero paano pag, okay. Pero
Ah,
yung sa, paano pag sinikon ka on the 10th day? How would you reckon that?
Mawala.
Again, Luchi, if you are still
What if you
symptomatic
develop a
on the,
cold or a cough on the 10th day? How would you reckon
then
that?
you can Yes, then you cannot be tagged as recovered. So kailangan nga po naming linisin ng ganito, no, na bine-verify pa ho yan dun sa line list natin. So when a person is not cleared by their physician as being as clinically recovered, and then they won't be tagged as recovered. Meron po tayong criteria, the clinical recovery and the isolation period. So the clinical recovery, kailangan ma-assess ka ng physician, masasabi ng physician you are already recovered clinically, and then dapat nakumpleto mo rin yung 14 days mo. These are the two major criteria for a person to be tagged as recovered.
But how do you monitor the ones at home? How do you know that they're going to be truthful and they will say, oh, wala naman akong symptoms during the 14 days? How do you how do you find out?
Yes, Luchi, the assumption would be that the BHERTs, they are mandated to monitor these persons at home doing home quarantine, and they would need to report. This person at home cannot go out of their house and cannot reintegrate until they can be given clearance by the municipal health officers or the city health officers. So they would still see this person because this person cannot, as I've said, they cannot reintegrate into the community unless they get their clearances from their health offices.
Hindi na sila
You said,
i-test. Hindi na mo
No retest anymore. No, the criteria right now, because of the evidence which has been published, no, I think that was 3 weeks ago, where WHO and even USCDC has signified, no, or has mentioned that on the 10th day that a person, positive individual, on the 10th day, they are already non-infectious. So therefore, you don't need to test that person anymore. If and when this person will be tested and turns out to be positive again, or still positive, that is just because the RT-PCR machine is very sensitive, but it doesn't tell you if the person is infectious or not. But experts already are saying on the 10th day, you are non-infectious anymore.
Yusek, linawin lang kasi maraming nag-aalala ngayon because of pronouncements from you on Monday na at least 6 regions have entered the warning zone in terms of bed capacity for COVID. And the DOH also said mega facilities for COVID have also entered the danger zone. How worried should people be about this? And what are we doing about it?
Well, it is because of the increasing number of cases. That's one. That's why hospitals, they are nearing this warning zone that we are seeing. Second, this temporary treatment and monitoring facilities or the quarantine facilities, they are nearing the warning zone because we are doing the Oplan Kalinga. If you remember, about 2 weeks ago, the Secretary of Health and the IATF as well has launched this Oplan Kalinga, where we are encouraging people or individuals who turned out positive and are doing home quarantine and they cannot comply with the conditions set forth for doing a home quarantine, they are being encouraged to transfer to these temporary treatment and monitoring facilities. And so far, we had been successful in doing this. That's why our quarantine facilities are nearing this warning zone. As to the hospitals, we have this one hospital command that we have established, where this is led by Yusek Bong Vega, the management or the treatment czar, wherein we are setting up this strengthened linkage or network among hospitals, between national and local government units, and between public and private, where there would be an incident command system that every time that there is a patient needing admission, this and the hospital is full, they can just call the incident command and they would be mapping out these hospitals with available beds so that they can easily refer the patient. So hopefully the traffic of patients will be managed by having this one hospital command.
So the patient will not under the one hospital command. The patient who doesn't want to go to a quarantine facility can go to another private hospital. So hindi siya pipilitin. Ganun ba yun?
Wala wala po tayong pilitan, ma'am. The patients are encouraged Pero kapag halimbawa po sa pagmo-monitor po ng ating mga officials at nakita po ng isang tao ay nag-home quarantine pero hindi naman po sila makapag-comply dun sa kondisyon para mag-home quarantine, like you have a separate room, you have a separate bathroom, you also do not have any vulnerable individuals in your home, and also you are being monitored by the local health officials, no? So kung hindi niyo po yan mako-comply, talaga pong ire-recommend talaga ng ating mga officials sa local government na talagang mailipat po kayo sa temporary treatment and monitoring facility. Another thing that we have with the One Hospital Command is that we have strengthened our implementation of our protocol, where all mild and asymptomatic cases are now being referred for temporary treatment and monitoring facility so that we can decongest our hospitals. Because it was noted that there were still mild and asymptomatic cases admitted in our hospitals, which pag tinignan ho natin yung protocol, hindi naman po kailangan. Ang kailangan ho natin talagang ilagak muna sa mga ospital would be the severe and the critical cases.
Okay, but ma'am, linawin ko lang po kasi I mean, people are hearing danger zone, warning zone, nakakakaba. Whether it's on the level of isolation centers or hospitals, bottom line po, is this just a matter of triage and traffic management, as you said, or are we in fact running out of bed space and capacity either in the isolation centers or in the hospital?
Kailangan natin intindihin, sir, no, we have to be informed that when we say that we are in the warning zone, in the danger zone, especially for hospitals, this is based on the beds that they have allotted for COVID. There is this protocol that we have, the guidelines, and they were mandated that for all public hospitals, they should have at least 30% of their bed capacity allocated for COVID beds or for COVID patients, and for private hospitals, at least 20%. But looking at the numbers right now, we still have not reached that 30% for our public hospitals and not reached that 20% for private hospitals. So now when we try to look at our numbers and try to assess them, and hospitals are saying that they are in full capacity, we have to look at the numbers. How many beds did you allocate really for COVID that we are saying that you are full?
So, ma'am, just to clarify, so you're saying it actually starts with monitoring the compliance of the private hospitals. So some have not actually complied yet.
Yes, that's right. That's both for public and private. That's why you will notice that the National Task Force, together with the Secretary right now, are doing the rounds of all hospitals in the National Capital Region just to ensure that they are complying, even with that surge capacity that we are mandating them to do. That if you are already reaching that capacity, that your 30% is full already, you need to expand more until about 50% for government and until 30% for the private sector.
Is there a surge already?
We don't really say it's a surge, but the cases have increased for the past weeks. The trends have increased for the past weeks, and a lot of people are going to the hospital to have themselves checked. But we have to look at the number of severe and critical cases. Although it has risen, but it has not exceeded this 1 to 2% that we have always had here in the country.
Ma'am, in the meantime, habang tumataas po yung numbers na yan, the Metro Manila mayors are saying na we should maintain GCQ. Are they on the same page as the DOH?
Nawala yata. USEC. USEC.
Nag-freeze yata yung feed ni yung stream ni Yusek. Pero anyway, Lucy, and then Ami, you know where the question is coming from. Kasi kanina, ang balita din today is that the Metro Manila mayors are parang inuunahan nila. They're already, I think that the numbers are out and all the reports about the numbers going up, the capacity of hospitals also getting to their limits. So parang now, yung Metro Manila mayors, inuunahan yung messaging and saying na whatever happens, we hope mag-GCQ pa rin, ha?
Huwag na bumalik sa MACQ.
Ayaw nilang bumalik sa stricter ano.
And of course, from,
GCQ.
kasi from their perspective naman, it's also the socio-economic impact that they're worried about trying to get the economy, but it's a real dilemma, as you can imagine, for government and the IATF.
Yes.
Lalo ngayon, sinabi nila Carlito Galvez na the burden of the response will be shifted to LGUs and to the private sector. So mahihirapan talaga yung mga mayor kung walang economic activity. Hindi naman pwede mag-completely rely sila sa national government.
Saka ira na, hindi naman in-adjust, di ba? Wala adjust sa ira.
Yeah, yung,
And
Yun, no?
and you literally see the gears of the private sector starting to gear up. Ngayon pa lang, libo-libong mga motorcycle taxis drivers ang nagpapatest na because they're getting the signal na, o sige, basta yung sumunod kayo sa protocols at merong testing yung mga drivers, dadami na rin yung motorcycle taxis, precisely anticipating an opening up of the economy.
Yeah.
well, we're waiting for an announcement tonight.
Diba? James, ano pa ba yan? Cinema.
Internet shop. Internet shop.
So,
Well, we're waiting for an announcement tonight.
no? Ang hirap naman. Yeah.
Siguro.
And driving around. Diba? I mean, well, ako, I get to drive around now every day. So now I make this trip from Quezon City, from Tandangsora, papunta dito sa Mandaluyong, every day now, balikan. And you really feel it. Diba?
That's where
Grabe na yung
really bad.
traffic talaga. Yung dati kong travel, and that's counterflow. Kasi nagpunta ako dito paggabi na. Diba? So counterflow ako dito ng southbound. And yung dati I would have taken this maybe in 1.5 hours. Now I still take it in about an hour. No? So dumadating na sa punto ganun. Whereas before siguro yung kasagsagan ng ECQ, GCQ, when I go here maybe kaya ko 20 minutes, 30 minutes.
Yeah.
Ang problema ngayon, yung iba daw, may mga report today, especially among BPOs, na yun daw mga daily wage workers. Nagsisinungaling kapag nagkakasakit at pumapasok na nagka-problema ngayon ng infection in several offices, especially in Quezon City. So
Kasi
yan ang problema.
No work, no pay. So sa kanila,
No work, no pay.
for the day, wala silang kakainin, di ba?
Yan ang problema.
Yes.
Yeah.
And you can scale up that term. You can scale up that term for an entire city, an entire NCR, an entire country. No work, no pay. That's exactly the dilemma of the entire.
Kaya nga bahala na kapag ganun eh. Yan ang
Actually,
problema.
kasi ang dami talagang asymptomatic, no? So, alam kong yung katabi mo meron, no?
Yan naman.
Nakakapraning eh.
Kaya usong-uso ngayon yung face shield.
Yeah.
Mask.
Nakakil.
Lahat na. Hindi mo malaman eh. Yan ang problema. Sana natanong natin kay Yusek Barrere. Kaso
But anyway, if we understand, tama ba yung pagkakaito? So among other things, so they're reconciling the data. So kayo po, pagka nakita niyo po sa balita kahapon, 4,000 yung naidagdag over the past 24 hours. But that's actually because government is doing a better job, they're saying, in not getting the data, but also reconciling. But among other things that they're doing also is reclassify yung mga mild and asymptomatic and never na-confined pero nag-recover. They're now counted. They're getting to count more of those people. And at the same time, pagka nag-recover, pasok din yun sa number of recoveries. Kahit asymptomatic ka, mild ka, once you're declared positive, negative, recovered ka. So tumaas din po yung number ng recovery.
Matatanong siguro natin, ayan na uli si Yusek Vergere. Yusek, welcome back.
Sorry, I lost my
Sabi po ni Secretary Galvez mukhang hindi daw tayo prepared actually. Well, he said na hindi actually fully prepared tayo, our facilities, for the pandemic. Do you agree with this assessment?
Ma'am, wala naman po talagang kahit na anong bansa ang naging ready para sa pandemyang ito. We tried doing our best from the start, no? tayo po ay nabigyan ng pagkakataon dahil hindi po natin napabilisan ang pagtaas ng mga kaso during these months, no? Dahil nga po dun sa mga ginawa naman nating interventions at the start. So we were able actually to prepare. We started off with one laboratory before, now we have 95. Dati po, isa lang po ang ating quarantine facility, yun nandun sa Clark. Ngayon po, 14 na po yung mega facilities and each LGUs have their own quarantine facilities as well. Our hospitals before, wala po tayong COVID-dedicated hospital. Pero meron po tayo ngayon sa iba't ibang mga regions natin. In Metro Manila, we have 3 big hospitals just for COVID. And we have COVID-accepting hospitals. Dati po ang mechanical ventilators natin, napakakonti lang. Pero ngayon, ang dami-dami na po. No? Marami nag-donate, marami po tayo nabili. So marami naman po tayong nagawa para paghandaan po natin ito. Pero wala naman po talaga, ulitin ko po, wala hong bansa na naging handa para sa pandemyang ito.
Ma'am, kumustahin ko lang po yung...
Yeah.
Kumustahin. Go ahead, Lucy.
Okay, ako muna.
Ladies first.
Yung United Nations, yung kanilang measure ay yung ratio ng worker or nurse and midwife to patients. So, ang dinidrill down nila ngayon ay napakababa ng ratio natin, no? But now, in COVID, ang lumalabas po ay hindi lang tayo kulang sa beds, kulang din sa workers. And in fact, yun ang sinasabi ng PGH no? Na kahit pa mag-allot sila ng more beds for COVID, the fact of the matter is wala rin silang nurses or doctors or frontliners. So, paano nga ba yun?
That's right, ma'am. Hindi natin yan ikakaila. No? We really have that kind of challenge when it comes to healthcare workers. Atin pong kailangang intindihin ang sitwasyon. Ito pong sitwasyon natin ngayon for COVID, ang atin pong mga healthcare workers, they have this kind of rotation. No? Halimbawa po, papasok sila ng isang linggo, another week, they have to rest, they have to go on quarantine so that they would be able to recover doon sa kanilang pagod at saka mawala rin po yung risk para makapag-transmit din sila kung sakaling na-expose po sila. So dito po sa ganitong klase na proseso, mas nangangailangan tayo ng additional workers because as I've said, meron po silang 1 to 2 weeks off every time that they go on duty. So nung tumawag po ang PGH natin, actually yung mga dedicated hospitals, inuna po natin yan nung nag-emergency hiring tayo. We provided additional manpower to them so that they can be able to manage all of these cases coming into them. At tuloy-tuloy po itong ating emergency hiring na ginagawa sa ngayon para po lahat ng ospital, both public and private, we can provide. Unfortunately, even with the money, the funds are there, and even with this call for additional healthcare workers that will be applying to DOH so that we can deploy them, ang takers po natin ngayon ay mababa pa rin po hanggang sa ngayon. So we are still calling out on our healthcare workers para po naman sila ay mag-apply sa atin. Last night we had a meeting and one of the things that was brought forward at nirekomenda would be that we should increase our incentives maybe so that kasi nga naman napaka-risky ng work, kailangan lang talaga i-incentivize na mas maayos at maipaliwanag talaga na talagang pangangalagaan sila ng gobyerno.
Ma'am, katulad po na, recently, in a recent episode, we spoke with the Nurses Association of the Philippines, and they noted this, and they were saying, it's ironic na merong shortage ng nurses. They can understand, they do acknowledge meron ding may pangamba, lalo na yung mga bagong graduate. At the same time, he said, we have what? If I remember correctly, 200,000 unemployed nurses in the country. Sabi niya nga, kahit hayaan mong lumipad sa abroad, take on in the US, we still have a glut and oversupply of nurses. What exactly, when we say maybe improve the incentives, what can government do to fill in this gap?
Well, ang dami nating tinitignan na mga paraan para mas ma-incentivize sila. Actually, there should be a concrete plan, at yun ang ginagawa natin sa ngayon. Dahil nga, katulad nga ng sabi natin, nag-umpisa tayo dito na talagang hindi naman natin alam na dadating tayo sa punto na ganito. Kaya ngayon, unang-una, syempre, yung kanilang pangangalaga natin sa kanila. That's what we would want to be very clear, no? Magpo-provide tayo ng enough na dormitories for them. If they are scared to go home to their houses, we will be providing transport. Incentive-wise, yung mga nasa Bayanihan 1, gusto natin ipagpatuloy yan sa Bayanihan 2. Pinag-iisipan pa yung extra incentives para sa ating healthcare workers so that they would be motivated, no, to apply and to work with us in government.
Ma'am, yung locally stranded individuals, you have sent back thousands of LSIs. Tapos, ngayon sinara yung Rizal Stadium kasi they're waiting for the results of 48, at least I think 48 people. Aren't you worried na mas lalala yung community transmission natin because of this phenomenon? I mean, the LGUs are already expressing concern about this mass return of people from Metro Manila.
Yes, ma'am. No, actually, for the locally stranded individuals, that's why we are ensuring that there are safeguards, no? Katulad nung tinetest muna po sila bago po sila pagbiyahihin. Pangalawa po, kailangan po ang mga local governments naman naka-coordinate na po yan na pagdating nila doon, meron pa rin po silang mga isolation na ginagawa para sa mga LSIs natin. So ito po mga ginagawa natin, iyan po yung ating sinasabing safeguard, no, para naman hindi naman sila makakontribute sa transmission na nangyayari sa ating mga komunidad.
Yusek, how do you feel about keeping the GCQ, yung recommendation ng mayors of Metro Manila that Metro Manila should just stay on GCQ despite the rising numbers? Do you think that this is just right? How do you feel about it?
Oh well, sabi naman, no, Lucy, yung mga experts nagsasabi, you cannot be in quarantine forever, no? Especially this very strict quarantine. Nung tinignan po natin yung mga datos at saka sinasabi ng mga eksperto, ang Pilipinas ay isa sa mga nagpatupad ng mga very stringent na quarantine measures. At hindi naman natin yan pwedeng ipagpatuloy ng tuloy-tuloy. Ang safeguard naman natin dyan, at sa tingin namin at napag-aralan po natin yan, na ang local governments ay bibigyan na mas malaking role dito. Sila ang mag-a-assess, sila ang magmo-monitor ng kanilang sitwasyon, at kailangan kapag ka nandyan na yung signos, no, yung signal, para mag-lockdown ka, kahit isang kalye lang yan, kahit isang building lang yan, o kahit 3 bahay lang yan, kailangan i-lockdown mo para ma-contain mo ang transmission. So that's the safeguard has been there, kahit na naka-GCQ tayo, but we have given authority to the local government unit so that they will be able to assess on their own, no, na nakikita nila na at kilala nila at alam nila kung ano ang nangyayari sa locality nila, they will do the lockdowns. And we think that this would be more rational because we do not need to close down the whole city maybe or the whole municipality, but just closing down specific areas in the place so that hindi naman din po natin mapapatay ang mga hanap buhay ng mga tao.
Ma'am, speaking of LGUs and now beyond NCR, 3-4 weeks ago, Cebu was the big story. And sinabi, naku, tumataas ang number sa Cebu. Pinadala doon si Environment Secretary Royce Matu. And now, people are saying, look at Cebu. They must have done something right because the case doubling rate has improved and so on. What did Cebu do correctly, would you say? And what lessons might that have for Metro Manila as it considers whether or not to move out of GCQ?
Yes, there were a lot of things that they have done and it was really successful and we can really see the trends in Cebu going down, even the deaths are going down. So pag tinignan po natin yung mga ginawa dyan, they had this community quarantine measure na talagang nag-ECQ, modified ECQ sila. And with that, ginamit po nila yung panahon na yon para makapag-lockdown ng specific areas, mag-contact tracing na mas maayos, mag-monitor po ng mga pasyente. At ang pinakamaganda ring nangyari dyan, yung kanilang one hospital command na ipatupad dyan. Nakita natin na na-overwhelm ang mga private hospitals nila noon at pumunta po dyan sila Secretary Duque, sila Secretary Galvez, and of course Secretary Simatu was on top of all of this. At nagawan nila yung very good na referral network among the different hospitals in Cebu, both public and private. Kung kaya na-decongest nila ang private hospitals na ilipat dun sa ibang public hospitals, nagkaroon ng balanse at nang manage nila na mas maayos ang sitwasyon.
Okay.
Okay, Health Undersecretary Rosario Berhere, maraming salamat po for joining us. Always a pleasure. Maraming salamat
Yes.
po.
Thank you
Thank you.
po.
Maraming
Thank you.
salamat po.
We need to take a break. Please stay right there. The Chiefs will be right back.
Ayaw. Welcome back to the Chiefs. We are now in the final stage of our conversation. And now joining us is De La Salle College of St. Benilde Vice Chancellor for Academics, Mr. Jeronio Ulayang.
Good evening.
Good evening.
Good evening.
Good evening. Good evening, sir. As we are shifting to blended learning, many have expressed concern over the readiness of teachers to handle digital modes, distance learning. And the Commission on Higher Education has stopped your school plus I think 5 other institutions to provide free training seminars to other teachers, other professors. Can you tell us more about this program? How are you going about it?
Well, our program will actually take place next week. So it's
Yes.
going to be a 5-day program, and right now we are targeting about 480 participants from 120 schools. We are actually prioritizing schools that have no capabilities in terms of institution-wide.
Problematic yata ang feed ni Professor.
Lakasan lang ng konti. Okay.
Speaking of, di ba? I mean, maybe we can try to reconnect. Now, speaking of the difficulties of blended learning.
Okay. Professor Ulayang?
Yes,
Mr. Ulayang? Okay. Please continue.
Yeah, so basically, the training is going to take place next week, and it's going to be for 5 days, and we are targeting about 480 faculty members from 120 schools.
Yes.
Based on the need that was expressed to us by the Commission on Higher Education, we are prioritizing schools that have no capabilities for institution-wide implementation of a learning management program. So the program will feature actually tips and practical suggestions on how to go about on how to jumpstart online classes with the available tools right now.
So these are professors from all over the country.
Yes,
They're
ma'am.
from all regions.
Yes, ma'am.
So ano pa yung ibang institutions, if you don't mind telling us? Sino pa yung ibang kasama dito?
I remember Far Eastern University, Tarlac State University, and Central Luzon State University. Yeah, I think there are still more, but those are the three. And Philippine Normal University. Yeah, the
Yes.
five of us. Yeah, the first group.
Kanayo, who are you training? The professors.
Yes, the professors.
Okay, and what are the assumptions, as it were, that they will have? What gadgets will they have? What gadgets are their students going to be using? Are you going to have uniform devices so that everything is accessible or doable? I mean, we're talking here graduate school, right? So
When we did the orientation, we basically told the potential participants that we prefer that they have a desktop or a laptop computer. Primarily because, well, number one, the size of the screen, they could see their co-participants and participate well in the discussion. Now, if there's no desktop or laptop, then a tablet may do. And the last option would be a mobile phone. Because the training is
Professor,
going, yeah.
Professor, ang ano ko lang, yung question ay kanina, pasensya na. Speaking of the problems of blended learning, akala ko ikaw yung may problema sa connection. Ako pa yung may problema sa, which brings me to my question. Beyond assumptions, what's the actual experience? I have two teenagers now, both in college. They're both having to do classes online. From what you're seeing from the ongoing, already starting online classes, what are the top problems that we are already encountering?
The top problem would still be internet connectivity. Sometimes walang signal, sometimes erratic yung signal. That's why what we do in BNIL is actually not a direct transposition of the face-to-face classes into online environment. So the common thing that schools are doing now is that they just duplicate whatever is being done in the classroom in the online environment. But in our case, we found that it's not going to be effective, or it was not effective. So we have more focus on asynchronous sessions, and rather than synchronous sessions, in order to address possible problems on internet connectivity. Synchronous means like this: we are real time, we are conversing on real time. Those are synchronous sessions.
virtual classroom, hindi ganon.
Yes.
Hindi ganon.
Classroom siya.
So you get assignments online or reading materials online. And
Yes.
then
Though we upload that. We upload the materials to the learning management system, so the students could access it anytime they want or they need to.
Right.
Now, the other form would be asynchronous sessions, wherein, for instance, I will have my own lecture. I will prepare a video of my lecture and then upload it to the LMS, and then the students will access it depending on on their convenience, and then they have to answer or to address the requirements after that particular presentation. So that
parang video on demand, parang VOD.
Yes.
no? Video
But
on
yes,
demand.
the main problem would still be really connectivity.
Yes.
Yung training program niya, do you have a skills levels na iba-iba? Halimbawa, for the really low tech, yung medyo sanay na, meron bang ganon sa training program niya?
For this particular program, wala po kaming describe na technical know-how. Aside from, of course, being able to use a computer or a device and connecting to the internet and navigating the internet, of course.
So,
Kasi tinatanong ko lang kasi hindi ba yung sinasabi nila, I don't know if it's true dahil yung mas bata daw for the younger generations, intuitive na tong mga gadget Yung medyo senior na, nasanay lalo dun sa yung face-to-face medyo mahirap yan. Totoo ba yan?
Papagalitan po tayo ng mga teachers namin. But
Matandaan na kami. Uwi na ng virtual.
kunyari lang, simple PowerPoints, no? You'll be surprised how people like me will not be very savvy with PowerPoint.
Yes. Ako, hindi ako marunong.
Ako,
And
hindi ako surprised.
Ako, hindi ako marunong. PowerPoint.
it might reflect on my final grade. I mean, not to be worried about it because I'm not a student anymore. But pag kinalaban ka ng mga bata, yung mga programs nila, grabe nga ang advance, no?
Yeah.
How do you level the playing field, even in graduate school?
Well, basically, the leveling of playing field would be really more on the content and the manner in which you communicate the lessons. In reality, for instance, I have a class, kunwari, of 20 students. Some of them would respond well to high-tech presentations, but some of them would respond well or better to text-based materials. So, tama yung observation yun that the digital natives are more adept in terms of using other applications or technologies.
Yes.
But for the faculty, the more important thing for the faculty is how do we communicate the lesson? How do we teach the lessons? And believe it or not, the students are actually very understanding as long as they grasp fully the concepts that you are teaching them. And that is the main objective of the training program.
But Professor, yun yung gusto ko talaga yun sa training program. We keep talking about the students. We have to remember we're trying to train teachers. Ano yung biggest barriers other than technology? What are the biggest barriers for the teachers, whether young or old?
Okay. For the teachers, of course, if a faculty is not very familiar with online teaching, normally there is a tendency to think that kung ano yung ginagawa ko sa classroom, dapat ganun din yung gagawin ko sa online. But normally that does not work because it actually strains more the students and the faculty. So what they normally do is we have the training program that we have is actually preparing the faculty on how to convert first the syllabus from a conventional face-to-face syllabus into an online type of syllabus. Because in online teaching, I think you will also see this in the lectures or webinars of other digital education experts, that if you're talking about a course and you're going to transition to online delivery, you're not going to follow all of the learning outcomes that you initially listed because that's going to be very challenging. So what we do is we tell the faculty, you have to identify what are the most important outcomes of this particular course and then focus on that. Focus your activities, focus your lectures, focus your materials, and focus your assessment on the identified outcomes. And that is the very first thing that we need to address. So that works for any type of faculty, kahit sabihin natin digital native or digital migrant or yun.
May prof, siguro kami, manghari kami dito kasi, we haven't attended class in a long time. At the same time, we haven't attended an online class other than watch videos, and we keep assuming it's just about watching somebody on the screen. But give us an idea of the kinds of online tools and online stuff that teachers actually have their disposal. Alam mo, Gucci, the other day, I was watching my daughter. She was attending class. Meron sila parang virtual blackboard. They call it Jamboard. I think it's with Google. Parang you post virtual and playing.
Yes. And they're
Professor, give us an idea of the kinds of tools that that professors actually have now online. That actually they don't have in the real world as well.
Saka dagdagan ko na yon kasi ang balita namin, your school will be going fully online for the coming school year. Tama ba yon?
Right now, we're doing full online modality. Next term, the institution decided to go on full online because we do not want to take the risk of face-to-face, even on blended modality.
Wow. So tell us more about that. Yung tinatanong ni Robbie kanina.
Give us an idea of the toys, and the tools that are at the fingertips right now.
Yes.
Okay. Basically, there are free platforms like Google Classroom, and then there are full-blown learning management systems like Brightspace and Canvas, and then there are some. The ones in the middle is Moodle. No, all of them would have their own respective discussion boards. They would have their own capability to post videos. They have their own virtual classrooms where they could do the real discussion that usually take place in the classroom. No? But unfortunately, for some platforms like Google Classroom, the free versions or the freewares, kuminsan wala silang capability to host the materials. Okay, so what the faculty could do is, if that is a severe limitation for the class, then the faculty has to complement it with other applications or other
Yes.
tools, like for instance email, Facebook. Believe it or not, Facebook group chats are also very effective in delivering lessons.
It
Now, for
actually
those-
sounds like fun, ano? It can be fun actually. You think this can be a plus for this shift to blended learning, that you present it to students as a fun way of learning. Pwede
yes.
lalo sa mga bata.
Definitely. And it also helps if the faculty would actually make the virtual classroom fun. That's one of the key in terms of engagement. Because one of the key problems on online learning and teaching is, that particular interaction between the faculty and the students and the students.
Yes.
Yung nawawala, kaya actually the faculty is also hesitant to totally shift because wala yung inherent value na yun eh. So the
Paano
faculty,
paano yung monitoring, Prof?
Yes.
How do you monitor? I mean, ito, nakaharap ako sa iyo ngayon dito. Tango ako ng tango. Hindi mo alam, nanonood pala ako ng YouTube dito. I mean, how can teachers monitor and for that matter have a real exchange with students?
How do you know that the thesis is
Bubulakbol.
not written by someone else?
Yes.
Kung ayun na, grabe ang kopyahan ng thesis, di ba?
if it's a thesis or full-blown term paper, there are also tools to check for plagiarism. Now, in terms of a virtual classroom, how do we check? There are available tools. I'm not just sure kung merong free. Kasi ang problema sa mga tools ngayon ang mamahal eh. So, I'm just sure kung meron. But at the end of the day, it's still going to be the trust between the faculty and the students. And if the students would actually be, doing something else, then that would reflect on the assessment. Especially
Kaya nga, yung grade. But you admit the grading system will be a challenge, no? Medyo mahirap siya.
Hindi naman, because you're still measuring certain outputs. And then your outputs would be in assessing the outputs you're governed by certain rubrics on how to assess. So you look for those characteristics. Halimbawa, is it a paper submission or is it a creative work? So for the faculty, meron siyang sariling assessment method kung saan niya binibase yung grade ng estudyante.
Meron bang maximum class size na pwede para sa ganitong klaseng mode of teaching? Hindi siya pwedeng lumagpas at yung ganong number of students per class.
For us, the advice given by our EdTech people is 25 maximum for an online class.
25.
Kami rin nun,
Wow.
Kami rin
And
nun.
ano yun, pilitan pa yun, marami pa yun.
Yeah.
But of course, you also have to understand that for a school, the class size actually has a direct implication on the financial finances of the school.
Yes.
So some schools would go to as much as 40. And
Yes.
talagang,
That's typical up to 40.
yeah, pag mayaman yung school mo, then you could go to 15 or 10. So on our end, pinilit namin is 25. Pero talagang sabi ng EdTech namin, sir, maximum na talaga yan. Hindi tayo pwede over dyan.
Now, in the meantime, Prof, I mean, the reality also is this is a lot of this is unfortunately ad hoc. A lot of this is in reality stopgap. In fact, a lot of this is emergency. But given all of that, I mean, what's the most realistic expectation as you're trying to teach teachers in real time to do this blended learning and distance learning on the fly? Can we catch up in time even for this semester or the next school year? Or what's the most that you can really expect that you can achieve in trying to train the trainers?
Okay, the training is designed to, to jumpstart a faculty's ability to hold online classes. So the expectation is going to be basic. It's going to be basic, but we are confident that the training would be able to equip them with the building blocks in order to further improve whatever they learned in the training.
Okay.
Okay. So it's a start.
Yeah,
Yeah,
it's really just a jumpstart, but targeting or focusing on the most important aspects of online teaching.
Okay.
Kaya even the methodology that we're going to use is going to be practical and procedural in approach. In our conventional training, you have to read, voluminous literature, and then you have to answer this before you could proceed to the next module. We're not going to do that for the training because of time. So it's going to be practical and procedural in terms of.
is it accurate to say that it would be easier for college students and even graduate students and professors than it is or it will be for grade schoolers, for high schoolers, di ba? Parang mas madali siguro yung sa inyo, no? Kasi you're dealing with, well, adults more than kids, right?
But I can't really answer that. I haven't taught in basic ed. Siguro kasi sa basic ed mas madaling ma-supervise yung mga bata, mas masunurin pa.
Hindi matutulog. Hindi matutulog. Ang hirap kasi.
Okay, we'll be
Lalo na kung ganito yung mga estudyante mo, Doc, ang hirap, ano? Ay, Prof, ganito yung estudyante mo.
Tech. Well, we'll be watching out for your program, Mr. Jeronio Ulayaw, the Vice Chancellor for Academics of De La Salle College of St. Benilde. Thank you for joining us. We've run out of time.
Thank you din po. Good luck
Salamat
sa
po. And good
Salamat
evening.
po.
Yes.
Stay healthy.
Yes.
You too.
And that will be all for this special edition of the Chiefs. But we hope what was discussed here will keep the conversation going. I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Romy Alampay, and we are One News.